My name is Marissa Ann Penley. My college, if you didn't know already, was nursing. My mentor is Dr. Julie Schwinn, who isn't here at the moment. So my research was causes of postpartum depression leading to effects and finding more information to help decrease postpartum depression and prevent it.
Just say yes.
Okay. So I just want to ask you guys a couple questions. You can just say yes or no, or raise your hand. So do you guys think that being a parent is difficult?
Yes. No.
Do you guys think that after you have a baby, you have an immediate bond with your baby?
No.
Yes.
Yes.
Do you think that after the baby's arrival, it can be so stressful on somebody that it can cause a mother to have no interest in the baby and have no interest in herself and maybe even hurt the baby?
Yes.
Yes. Okay, so now that you guys have an idea of what I was trying to work on, I'm going to show you guys a YouTube video about postpartum depression and the symptoms.
Yeah. Here it is. Minimize your screen.
It's behind
It's behind your presentation.
How to detect the symptoms of postpartum depression. Postpartum depression is more serious than the typical baby blues that can occur after childbirth. Learn how to identify this condition so you can treat it and spend more time enjoying your baby. You will need knowledge of the symptoms and medical attention. Step 1. Take note of constant feelings of sadness, shame, inadequacy, or emptiness that continue past the first 2 weeks after childbirth. Step 2. Look for loss in appetite or a drastic change in weight. Step 3. Think about whether you lack energy or motivation, or have difficulty completing tasks. This condition often results in a loss of pleasure in anything about your daily life. Step 4. Watch for signs that you may be having difficulty bonding with your baby, family, or friends. Step 5. Be aware of thoughts about harming yourself or your baby. Step 6. Understand that postpartum depression does not mean you're a bad mom, and know that there is help available. If any of these symptoms are present, talk to your doctor immediately. Did you know? After childbirth, 50 to 80% of women experience baby blues, a temporary depression that usually goes away within 10 days.
So that was a video. Okay, so that video obviously you can tell was about postpartum depression symptoms and if you didn't know you had postpartum depression or not. And that video caught my eye the most because it was not as you could see in the present, it was in the past, and it made me think about, this problem was going on for a long time and I don't really hear it that much in the news anymore, so I think it should be brought up. And when I told my mom about it, she was proud, and that made me proud, that made my mommy proud. So my purpose was to research, well, I thought about myself as a nurse to help educate mothers on postpartum depression, ages 15 through 30. I was really focusing on the younger age because they needed to be more aware, and it seemed like the younger you are, the faster it is to get pregnant nowadays, so I just wanted them to make sure that they knew what they were getting themselves into, especially if they weren't ready. And also, I researched preterm labor affecting postpartum depression. So the 6 stages of postpartum depression, I got this straight off the internet. You can see my citation right there. So 6 stages: denial, anger, bargaining, depression, acceptance, and PTSD. I'll get to PTSD in a minute if you don't know what it is. So denial is when you're thinking to yourself, there's nothing wrong with me, I don't have postpartum depression, so I'm just going to move on. Anger is when you feel that nobody understands you and why is this happening to me? Bargaining is something that you feel like, okay, I might be sick right now, but if I go hold my baby or do the laundry or something like that, I'll feel way better. Depression is when it's actually sinking in, and that's when you know, like, okay, nobody's here for me, and I don't think that I should be around my baby because the baby is like, she doesn't deserve me, or he doesn't deserve me. And the acceptance is actually accepting the fact that you have the depression, postpartum depression, and that's when you seek medical attention. And PTSD is post-traumatic stress disorder, which is basically after you have postpartum depression and you don't have it anymore, you're on the lookout just to make sure that it doesn't come back. So my background information are just some key terms that I wanted you guys to know. If you didn't know what postpartum depression was in the video, it's just a state of depression that occurs after the couple of days of having the baby. It can occur longer, about 6 months I've read, and it's when you have no interest in the baby or yourself. Now, the way I define single mothers may be different from the way you define single mothers. So the way I defined it was a mother who doesn't have a spouse, boyfriend, husband, or significant other that's helping them through this transition of motherhood or postpartum depression. They may have like their parents and their friends, but specifically not somebody that's supporting them. So minorities is also something that I define differently, African American and Hispanics. So my 3 citations, I'm only going to read the bolded red ones because those stuck out to me the most. So non-white mothers reported initially higher symptoms. This goes back to my minorities focus, that Hispanics and African Americans were more likely to get postpartum depression. Such as stressful events. This quote right here talks about how postpartum can start, and I wanted to focus on stress, so that showed me there. The last quote is stressful life events and lack of social support. So this is also talking about how postpartum depression can start, and lack of social support stuck out to me the most because that's what I wanted to do to intervene with helping women with postpartum depression. So my methods, I chose 25 women to interview, ages 15 through 30, and they had to be African American or Hispanic or both. They had to be either diagnosed with postpartum depression or associated with it, so they knew what it was about. And the survey was about, if you ever went into I'll tell you what I'll show you what the survey looks like, but it was about preterm labor, nurse help, age, and more education on postpartum depression. So this is what my survey looked like. You can see my little letter to the people who took the survey. I don't know if you can really see it, but basically saying that this is a survey just letting me know that you want more education on postpartum depression. And those were my questions. So these were my results from all the 25 people who took the survey, the time, the day they took it, and their answers, and the age. So my next one, I didn't really know how to do a 2x2 table, so I started out with a 6x5. So I felt that all the information on here was needed, and plus when I did figure out how to do a 2x2 table, I did not want to erase all that work. So here's my 2x2 table. So my relative risk factor was that a group of women older age are 12% more likely to decide that they want more help, more education on postpartum depression. And this surprised me because I was focusing towards the teens, but the older women actually wanted more education. So here's my overall results to every single question. So in conclusion, I found that the older you get, the more education you want. And when I asked the younger women, like I asked my friends because they had babies and they went through postpartum depression, I asked them, so why didn't you guys want to learn more about it so you know how to prevent it or tell your friends like to deal with it? And they were just like, oh, we don't care about it, it's not that important, but they don't understand the significance, so that was hard. My discussion, my strengths was the population. I knew who I wanted to survey and I knew who I was going for. My limitations were that the younger women did not want more education because I was not prepared for that. My comparison of the results for the minorities that I chose, African Americans and Hispanics, seem to be diagnosed more than others. My quantitative data was ages 19 through 25. Quantitative means that I was surprised through this. Received more help from the nurses, yet they still wanted more education. And when I say received more help from the nurses, it means that like right after they had the baby, they were there for a couple of days, and the nurses like told them like it's okay. They just basically helped them throughout this troubling time. And then if I can continue further with this research, I would have added more minorities so I could see how it affects from African Americans to maybe even Asians and stuff like that. So my intervention, I wanted to start a postpartum depression meeting. It was kind of like Alcoholics Anonymous. So what I wanted to do was I wanted to have all of the 25 women meet up, and I was gonna support them with a free daycare or a free childcare so they don't have to worry about where their children had to be. And I wanted them to just basically discuss like what postpartum depression has done to them and how it's affected them through their daily life and what they're doing to make sure that it doesn't happen again. So during this meeting, I wanted them to go out and spread their knowledge. Everything was confidential that they were talking about, but there's gonna be things that people who do have postpartum depression out there don't want to come in and talk about it. So those people who did come to the meetings, I wanted them to go spread the knowledge and say, it's okay that you have this and there's ways to fix it. So this is a video about solutions to postpartum depression.
Hi everybody, I'm Amber Pozo and welcome to Mommy's Minute. If you're experiencing postpartum depression symptoms that are lasting more than 2 or 3 weeks, it's time to seek professional help. Here are some treatment options that your healthcare provider may suggest. First, joining a support group is a great idea. Being able to talk to other women who are Hi everybody, I'm Amber Pozo and welcome to Mommy's Minute. If you're experiencing postpartum depression symptoms that are lasting more than 2 or 3 weeks, it's time to seek professional help. Here are some treatment options that your healthcare provider may suggest. First, joining a support group is a great idea. Being able to talk to other women who are experiencing the same things you are is always reassuring. Recent research shows that antidepressants and talk therapy combined can also be very effective in eliminating postpartum depression. And also, don't be afraid to ask or accept help from others. Friends and family will always be more than willing to do anything they can to help you get to a speedy recovery. And while your baby sleeps, take those extra minutes to relax and take a nap. Don't worry about the chores, they can wait. And if you can, try to get out once in a while with your spouse. Go to dinner or even a movie. Most importantly, try to maintain a well-balanced diet. That's always a good idea, and especially for women with postpartum depression, because it helps to elevate their mood and their general sense of well-being.
So as you can see, the first thing that she stated was join a support group to talk about postpartum depression. And I believe that that's even better than taking medicine because I don't believe in using drugs at all. I guess it's the way I was brought up. But if you have to take that, then you should. But I think that discussing your problems to another person will make you feel a lot better, especially if they're going through the same thing, so you guys can relate to each other. So here's my references to all my sites. And are there any questions?